Hi, welcome everyone. This is the session on HIPAA for Infosec professionals. And Michael Brown, I'm trying to introduce Michael Brown. He has over 20 years of experience implementing information security systems, performing security risk assessments, and he has spent a lot of time researching upcoming trends, including the Internet of Things and mobile device security. Without much ado, let's welcome Michael. Thank you.
I'm kind of curious, how many people here are already kind of familiar with HIPAA? Okay, so this might be really boring for you guys, because the intention is this is meant for people who don't know HIPAA. But maybe I'll touch on something that you have not dealt with. Part of the job that I do as a security consultant, I do a lot of HIPAA risk assessments. I work with a lot of variety of healthcare clients and others. And they work from, I think our smallest client was a one doctor office, a psychologist office, up to large regional hospitals and everything in between. And the things I've seen have just been, as a security professional, very, very, very scary. So let's jump in. I think as security professionals, we're probably all familiar with CIA, confidentiality, integrity, and availability all around securing data. HIPAA, the only difference with HIPAA is for all that HIPAA is concerned about is data that's medical records. They don't care about your financial records. They don't care about credit cards. They don't care about your intellectual property as an organization. All HIPAA is about is securing medical records. And by and large, what it expects an organization to do to secure that is, by and large, standard security practices. There is, however, as if you go through the HIPAA regulations, there is some emphasis in certain areas. Again, we're talking about medical records. So when it comes to confidentiality, HIPAA is really big on, do you know who has access? Do those people who have access, are the ones that they're supposed to have access? We don't need, say, nurses leaking information from your celebrity patient and stuff like that. Integrity, again, we're talking about medical records. What's in medical records? It's the medications that you've been prescribed in the course of care. What would happen to someone if someone goes in and changes those prescriptions or those course of care that it's not being, could it lead to them being killed? So they want to make sure, hey, are you logging and monitoring who is going into your medical records and making changes, making additions? Is that a legitimate change or is it not? Are you doing anything about it to make sure that's not happening? And availability, okay, for most people when we think about availability, we're talking about, highly available systems, but also things like, hey, business continuity, disaster recovery. Yes, that's all part of it. But there's also a concept in HIPAA, what we call a contingency plan, as in, what are you going to do when that ransomware takes down your system? How are you going to continue to provide patient care? And more importantly, do you have something in place for that? And oftentimes that's the case. So the big thing, of course, is all about, healthcare has become more and more electronic. Patient health records are being put into systems. They're being accessed everywhere, being passed around and so forth. And there's a big concern about protecting that. What's actually kind of scary for me, because again, part of what I do is I actually do training with our clients, is people don't understand why this is important. And I'm talking about people in terms of like the people in the healthcare profession. I think all of us here as security professionals understand things like, hey, we want to keep our credit cards secure because people want to steal our credit cards and use them and so forth, and they're big, very valuable in the black market. Then when it comes to medical records, a lot of people are like, well, yeah, I kind of understand why it's important to keep it secure, but, are people really trying to go out and get medical records? I actually have that question asked for me for people in the healthcare profession because they don't understand that. They kind of understand that it's important, but they really don't fully understand it. Then when I tell them things like, well, you see, you got to realize on the black market, medical records are $50 for a record versus $1 for a credit card. They're like shocked at that. And then of course we're like, well, yeah, but why? And then I think, well, okay, because then people can take those medical records and they can do identity fraud, or they can put fraudulent claims in for for health care services and so forth, and rack up lots and lots of money. And unfortunately, a lot of people in the healthcare industry don't know this until hopefully we can train them and get them to understand. And then of course, hopefully the light goes off that, oh yeah, that's why I need to be shredding paper and doing this and doing that. And that's the big problem, is that a lot of them don't. So what is HIPAA? Health Information Protection and Availability Act. It was actually put out in 1996. I've actually had one doctor say, like, HIPAA, that's been around since 96, why is that a big deal now? Well, unfortunately, things don't stay still when it comes to government regulations. The initial regulations wasn't that much. It was a little bit about protecting data, but they've added to it, and they've added to it, and the addition add-on is what has made HIPAA much more important. Don't laugh, but it's kind of funny when you go and deal with people who are doing the HIPAA work and whatnot, and you pull up their brochure or their website or their flyer, and they've got HIPAA misspelled. So they added more stuff. They added the privacy rule, and they added more of the security rule, and of course the big one here is high tech. So someone might hear the term high tech or HIPAA high tech. High tech was another regulation act that came along and added a lot of stuff to HIPAA. And this was in 2009. It had things such as the breach notification. Now, if you lose records, you got to report it with a big threshold of 500. That's the big important thing. Is that if you hit 500 500 records breach, you have to report it almost immediately, versus get around to it type of thing. Also, it applied rules to business associates, those who do work for the covered entities. That then, of course, spread who has to be worried about HIPAA regulations. And it, of course, added penalties. If you don't do it, you're going to get penalized. And then in 2013 is where it got really serious. They had the omnibus final rule. It strengthens a lot of stuff, put in a lot of regulation, codify things better, and that's why since 2013, HIPAA has become very, very serious for everyone dealing with medical records. I don't have a whole bunch of graphics, but I just love these memes and so that kind of. So I talk about penalties, and the takeaway here is the penalties go up from like 100 per violation up to 50,000, but it's based upon what goes on. You did the best you could do, you skirted the best you can, but yeah, it got out. Okay, you're going to be penalized by not too much. Versus you just didn't freaking care and you let it out and you did it multiple times. We're going to really penalize you, including criminally. And one thing also has happened is now we have audits. Instead of just, okay, you need to follow the regulations, we're going to go and check you out. So AJ just started doing this. Now, the first one was, what the ones that you hear was phase one or the pilot in 2012, 2013, where they did a few entities that could check things out. Then last year, they started phase two, where they did what was called desk audits. And basically that was, they went out to these organizations by random saying, give us all your policies, procedures, all your information, and we're just going to take a look at that, as opposed to people going and visiting these places. And then currently following up this year with on-site audits. As I understand, they took the information from last year's audit and decided about who they're going to go check out this year. I've not seen anything about what's going to happen going forward or how they're going to do it, but certainly it's very clear that HHS will be continuing to do audits, and more of them. They've actually put it into the budget. And what's kind of scary is they're hoping, their expectation is they're going to fund the audits from the penalties.
So,
Yep.
There are a lot of penalties.
And we can't forget state law. State laws also have an effect. And in Florida, we have HIPAA. You may not have heard of that, Florida Information Protection Act. It's more about what's called PII, personally identifiable information that identifies as you as an individual. But it's stringent. The thing is here is that with HIPAA, you need to report breaches of 500 more records within 30 days. HIPAA, it's 60 days. And Florida is the most hardest of all the state laws. So you have to be worried about both of them. So what is it? By and large, HIPAA is just, if you look at what it expects, it's basically basic security practices. But what's kind of confusing is they use different terms in some areas. It makes it kind of confusing. They've already used several terms like covered entity and business associate. What's that? And there's this thing called HHF. What's that? So some of these things are what we're talking about might help. Okay, so we talked about, I thrown out the term privacy and security. What are we talking about here? And you get a couple of different things. We have the privacy. So in HIPAA, we have both a privacy rule and a security rule. They also expect that you have a privacy officer and a security officer. And they expect organizations to have privacy policies as well as security policies. So what's this all about? Privacy is going to, in this case, is a bigger area. It's all about protecting all patient information in terms of whatever form it's in. That means in paper form, electronic form, written form, as well as spoken form. You may not think about this, but if you've got two doctors in the hallway talking about a patient, and they say too much, such that someone walking by can realize, oh, I know who they're talking about, guess what? That's a breach. But that's whereas security deals strictly with protecting the information when it's in electronic form. So in this case, security is almost like a subset of privacy, but sometimes we kind of view it kind of side by side. So what I also see with many organizations that they have a privacy officer and security officer. Oftentimes, the privacy officer will be the legal counsel, because oftentimes they'll be the ones who are dealing with the reporting of the breaches and this sort of stuff, and dealing with the larger issues. The security officer would be someone who we would consider a CISO, whether they're named such or it's the de facto CISO. Now that they should be complementary. They even say, hey, do you have these people and are they working together and stuff like that. So I mentioned covered entities, really simple. Covered entities are anyone who generates medical records. A doctor's office, medical clinic, a hospital, as well as healthcare clinic. These are considered covered entities, or we say a CE. Then we have business associates. Now, obviously, if you've got an organization, you probably have what we call a vendor or a third party. Well, that's what a business associate is, but it's a special type. There's a third party for a covered entity, or it could be a third party for even another business associate. But the key is they are given patient information as part of the work they do for that covered, for that other group. So that makes them not just a third party, but a business associate. So what they expect you to have is they expect you to have a legal document called a business associate agreement, which we just call a BAA, which makes sure that's clear, because here's the thing. The covered entity is subject to HIPAA regulations. Business associates are covered also with the HIPAA regulations. They had to follow the same regulations. And the business associate agreement is important because it makes it very clear that, hey, you're a business associate with us, you are subject to this too, you need to be doing a security risk assessment, training, all that sort of stuff, just like we do, and you have to report to us when you have a breach.
Question.
But like I said, not all third parties to a business to a group is automatically business associate.
Clarification on PHI. Is that?
I'll explain what that is. That's another one of those, again, another of those terms that we have in HIPAA that makes things confusing. I will explain what PHI is. So these are some examples. You see a lot of writing. We outsource, our IT services. Someone we talk, there was a guy talking earlier today about cloud services. If you're going to outsource it, your stuff to a cloud, they have to have a business associate agreement. And the thing is also, many of the companies that are kind of in this space who wish to work within the healthcare realm, they make it a point to say, we are HIPAA compliant, we will sign a business associate agreement, we will do all the proper things, and those are the groups that they should be, if you're a covered entity or whatever, that you should be working with, versus the ones that go like, business associate agreement, what's that? You should run for the hills. Unfortunately, I see it a lot with like some of these small doctor offices. I ask them, okay, you have paper records, where are they? Hoping they're not, like, say, in the doctor's garage, which they have been. And then I get we have them in Uncle Bob's storage farm. And I'm like, that's not a business associate. They don't sign a business associate agreement. Oh, well, we don't want to go to Iron Mountain. They're too expensive. Because Iron Mountain will sign a business associate agreement, but that's part of the problem is they don't want to spend the money that unfortunately the people who have to do all the extra work to be HIPAA compliant are going to expect. And that's part of the problem of dealing with all this sort of stuff. So someone asked me what PHI is. This is what PHI is. It's protected health information. A lot of people slip up. We say patient health information. No, it's patient as protected health information. I even slip up too. And putting it simply is, it's medical records, of course, PHI, because what makes it PHI is personally identified information plus medical information. So if I have enough information that I can identify a person and I have something about medical information about that person, a diagnostic, a test, those together comprise PHI. So yeah, a whole medical record for someone would be PHI, but also just a little bit of subset. If I got a test report for that person that has like their social security number and their test results, that's PHI. If I got a picture of you and the surgery being done to you, that would be considered PHI. So that's why it's much more pervasive than just, oh yeah, here's your medical records in this file folder. It can be things like a scan, digital files, cameras. I go to my dermatologist and they take pictures of part of your body for things, and all those pictures are PHI. So all that has to be secure. Yes?
So if a company, a large company, has a risk office or whatever, they handle workman's claim comps, lawsuits, things like that, and in all of that legal stuff going on, they acquire...
Yeah, PHI, yes, they have to secure it. Because being part of, I said, when I talk about business associates, right. Anyone who has been given PHI makes them a business associate. They're subject to the HIPAA regulations. So there are actually companies out there who they're looking for a security person, and sometimes they'll say they want someone for HIPAA, and I'm going like, HIPAA, I'm looking at what the organization does. It's like they're not in the healthcare realm. Right. And then I look further and realize, here's what the thing is. They're being given, because of workman's comp and stuff like that, medical records of their employees, and they have to keep it secure. So they're subject to HIPAA regulations. Some of our clients are schools, universities, which in some cases will have clinics on their universities, which means they have medical records of their students, right. Which means they're subject to HIPAA regulations. So they have to keep all that sort of stuff secure. So a lot of people don't realize who gets impacted, who needs to be subject to these regulations. If you've got patient information that's been given to you and you got to secure it, then you got to follow the regulations. It's getting pretty messy. There's of course a breach, which is a very, very serious thing. Basically, when you have anything lost, stolen, or improperly disposed of, i.e., you have paper records, someone goes in the trash as opposed to shredding it. The employee's got the laptop with all the medical records and it's stolen out of the backseat of their car, which yes, happens all the time. And of course, there's the hacking. People breaking into the system, stealing data, and so forth. That is all a breach. And the thing is that if a breach occurs, it has to be reported, and it also has to be reported to the people affected by it.
Quick question.
As I mentioned, there's that threshold of 500. If a particular incident affects 500 or more people, it has to be reported immediately to HHS, and typically it also has to be reported to the general public, and oftentimes, and of course, it has to be reported to people affected by it. So that's why when people get like this letter from hey, we have a breach or even a suspected breach. We think your medical records were breached, and so we're going to help you out by giving you a year's worth of credit monitoring. That happened with my parents. They had apparently all their medical records may or may not have been in this truck going down I-75 to be shredded. The back popped open, papers everywhere, and And this was actually in the news. It was actually down in the Fort Myers area. So. It's pretty serious. Even if you suspect a breach, I mean, that's why, if an employee's laptop is stolen and there's the chance that they can have medical records, then you have to okay, well, how much could that have been on there and this sort of stuff. It gets really, really messy.
A quick question. How does, if your medical records get compromised, how does that translate into credit card information?
Because it's any theft. They'll take your information they got from medical records and open up credit accounts in your name, credit cards and this sort of stuff, lines of credit that could affect you. So that's part of why people want those medical records, because that gives them information. They can easily start opening all that sort of stuff up. And I had someone ask me about this. He was like, well, hey, if they had a breach and we decided just not to report it, and I'm like, I did not want to be around an organization that had a breach and didn't report it.
Yes, I have a question about the stolen laptop.
Yes.
Would it be sufficient to just demonstrate that the laptop was encrypted?
Yes.
And then
Yes. That's why full disencryption is really, really good to cover yourself for that. But you have to be able to prove that yes, you encrypt it. That's why a lot of the medical organizations have now gone to every laptop is full disencryption, and a lot of them have been doing that for desktops. If the laptop is lost or stolen, and they can prove it's been fully encrypted, they're covered. It's called a safe harbor.
And what if it's not fully encrypted?
Then you have to assume that it's been breached and you've lost the records.
And just come up with a number?
Well, you have to kind of do the best you can to figure out how, or even the worst case. This person, maybe only had 100.
Because of their role, they may not have had a need to.
Yeah, well, you have to hope so. Really, some employees that have access will take advantage of things.
Okay.
So and actually one of our clients, it was actually funny. I was talking to them. They did full disencryption across the board on all their laptops, and I was like, okay, well, you're doing like a way to forget the term, like if someone forgets their encryption password, you have that key management to get it back. They're like, no, we're not bothering with that. Like, really? See, our policy is you're not supposed to save anything on the laptops anyway. So if you do forget it, we'll just re-image it because there should be no data loss because you weren't supposed to save anything anyway. So to them, it was just like the full descriptor was like kind of cover themselves if it would be stolen. And I'm like, okay, if it works for you guys.
Good question. How about the BYOD factor?
Yes, very much so.
New thing.
I thought that was interesting. I don't know if that would fly other places, but works for them.
Not BYOB.
Sorry?
Not BYOB.
Yes.
BYOD. Somebody asked me, BYOB,
Yeah, sometimes they do that too. Now, tied to that, we have this, which we refer to as the wall of shame. That's not the official name. However, you go to Google, type in HHS wall of shame, you will find the website. Here's the thing. If, again, that 500 record threshold, in addition to everything else, you get to go up on the website and get listed. It's very interesting. You can do searches on it. If you want to sort by the number of records, that's really interesting. So you use the top of the list. You can search on if they're a business associate or a covered entity. You can also just search by state, and that's interesting as well. So if you just want to hear about who in Florida has been up on the wall, take a look. This was, I'm not sure this record, but AvMed was probably our top one here in Florida. This was kind of scary. Memorial Healthcare is on South Florida. They've had 3 incidences of those. Guess what? They're listed 3 times. And some of kind of interesting. Ladies First Choice. That was kind of really strange. I was looking at that. But that kind of is illustrative. In this case, what it was, I had to do some research. I had to do some other searching. What it was an employee stole a laptop with their customer list with the intention of using it to solicit their requirements for a business that they were starting. Well, unfortunately, it wasn't just a customer list, it's become PHI, so it was a huge issue. And there's also that, there's also whistleblowers. So if you think that we're just not going to report it, someone else's organization will drop a dime on you. I thought meaningful use is something I hear it a lot.
I got a question pertaining to the thing you just mentioned about the last slide. If I know a client that they came in and asked me for an initial, whatever, assessment, and they're so whacked out that I don't want to touch them with a 10-foot pole, but yet they don't recognize the issue that we've seen. Is there any financial incentive for me to turn them in?
Nothing where I've not heard of anything where like turning it to criminal, unfortunately.
That fixes a lot of problems right there.
No, Medicare.
Well, for Medicare fraud, yes.
And usually when they have
So meaningful use doesn't really apply to us per se. What this is a program that's been on for several years. This is the last year of it, which is they're trying to get these organizations to get onto electronic health records, and there's a cost to that. So they figure, okay, let's encourage them to do that by giving them money, because that never is a problem. But they have to do things to get that money, and part of that is they have to conduct a security risk assessment. So sometimes we get called in by clients because they want to get their meaningful use money and they need to have a security risk assessment. And of course it's really fun because, if you want to file for like 2016, we need to come in 2016 and do it. So we get these people that come in like after the year and they're like, okay, we need to file for last year. Like, that's last year. We can't do that.
The IRS.
Yeah. It doesn't work. So I mentioned HHS and OCR. HHS is Health and Human Services. That's the federal department that HIPAA falls under. OCR is another one you should be familiar with. That's Office of Civil Rights. And of course, I would have had it. The question is like, civil rights? Well, what does HIPAA have to do with civil rights? Okay. OCR is HHS's enforcement arm. Okay. And so now that HHS is doing audits and this sort of stuff with, HIPAA, OCR has now had that responsibility as well. So instead of creating, the HIPAA police or what have you, they just turn it over to OCR. That's a problem. I mean, I've been to some doctor offices where I can see the screen and whatnot, which is like, so HIPAA regulations, this is kind of like where it fits in. I tried going and reading the actual real regulations, and I kind of threw my arms up. So how HIPAA is organized is they first, controls maybe not be the right term. I use that because as an IT security person, that's what we talk about controls. Okay. So they've kind of organized it with a security rule, because that's what I said. We deal with a security rule that's safeguarding of PHI in electronic form, and they group it in basically three groups: administrative, physical, and technical. Administrative is, of course, I kind of think is kind of the back-end security stuff, i.e., do you have policies and procedures in place? Are you managing your workforce? Having business associate agreements in place and so forth. That's kind of the administrative side. Physical, here we're talking about physical security of course, IT resources. Do you have those computers and servers in a secure location that people can't get to? Do you have badge access or key access and this sort of stuff? All the physical things in place. Versus, I can go to some doctor offices and their computer is in the break room. And anyone can get to it. Technical, of course, is all the technical, IT technical stuff put into place in the system. You have access control, giving people unique user accounts and giving them access. You have encryption in place, all that sort of stuff. That's become the technical stuff. And there's some areas that kind of fall through all of them, like disaster recovery. Well, disaster recovery, there's an administrative side, there's the physical side, and there's the technical side. So some things kind of go through all three areas. And one thing also they do, they kind of like have different categories. They kind of categorize things in different ways in what they call information specifications. One is a standard, which is like a rule requirement, you must do it. They also have required, which is pretty straightforward. You must do this. Then they have this one, which is kind of squirrely, which is called addressable. Addressable doesn't mean it's optional. It means that you need the practice needs to assess, which I'm always leery of because I don't know if they really understand these things fully. is that if it's reasonable and appropriate, then they should implement it. If it's not, they do still need to implement something else that's appropriate. And so this is kind of how the hierarchy is organized. You have the security rule, you have the safeguards, then the implementation specification, and they have, I call them control, but they might have them as questions. I'll show you an example of that. And they have these 5 areas. Of course, also breach notification, which is important. So this is the things they have under administrative safeguards. And again, as an information professional, most of these things make sense. You know, they have to do like risk analysis, risk management. The R's and S's we're talking about, like required, addressable. The numbers is how many questions they ask under each one of these. So most of these are pretty straightforward. You have an incident response program. You do password management. Are you monitoring who's logging in? This is the thing where, hey, is someone trying to get into your system and doing lots of failed logins? Is that a problem? Some of the things you'll hear about workforce, so you understand workforce clearance, that means, hey, are you doing a background check on your people? And then termination process. Hey, when someone leaves, do you have a checklist or something that you're following to kind of close things out? Because we all know that when people leave, that's always taken care of.
Can I ask you a quick question about background checks?
You have to sign the security official and this sort of stuff. So again, and sanctions policy, this is the term they use in HIPAA, it's basically a disciplinary policy. If you do these things, we're going to discipline you. Okay, the first time we'll write you up or talk to your manager, and up to and including we will fire you. As in, you're doing something super egregious. We caught you stealing PHI type thing.
I had a quick question. Sorry, I'm missing.
Well, what I was going to ask was, so this can have a whole variety of different problems with it when I look at this slide right here, because you can get down pretty granular to your level of people, but most people look at that from one organization. What if you're looking at, let's say, a hospital that now contracts with a medical provider for their medical records, who then subcontracts, who then uses work-at-home type people to do the transcription?
That gets into, again, vendor management type practices. But here's the thing is, that's why you have those business associate agreements in place, because the covered entity has the business associate. They should be checking those business associates to make sure, hey, you tell us you're HIPAA compliant. Are you doing training? Do you have policy procedures or not? Some do it, some don't. And that's the thing is, we actually do this with a lot of our clients. Some of our clients are covered entities. Some are business associates. And the funny thing is, some of the business associate ones, they come to us because they're like, we do work for this healthcare company, and now they're coming to us and they want to make sure that we're doing training and policy and procedures, and we don't have it, so we have to work with them and help them and get them in line. And then that's the thing is that some cover entities do a better job at that than others.
Is it the hospital's position then to then go through and examine each tier?
It's the covered entity's job. They should make sure their business associates are doing the proper thing.
Right down.
Unfortunately, just because the way it is, it's typically the bigger covered entities who are doing this. We typically see it with the hospitals and the healthcare plans.
Okay.
They're the ones that they're more likely the ones that are going to go to the business associate and say, "Hey, we want to see proof." And actually, it almost got comical with another of our clients, where they really weren't a business associate to a healthcare plan, but the healthcare plan almost acting like they were a business associate, expecting to do all this stuff, and we're like, no. They're a third party. They get their shit, they have their stuff, but they're not a business associate. They don't need to do all that extra stuff. Yes.
Yes. Along those lines of demonstrating proof, what obligation does a large healthcare organization have in terms of validating that a so-called vendor is HIPAA certified? What would you say?
Well, there's no such thing as HIPAA certified.
That's what they claim sometimes.
No, I'll get to that. There is no such thing as HIPAA certified.
Right. Yeah, I had a question about the background check.
So what would you?
I'll touch on it. The thing is, they should do due diligence in terms of going and checking out. Like I said, in this case with the one I'm talking about, and we never say our client's name, so just it was a healthcare plan. It was a company that was doing IT work for them, and they were being treated almost like a business associate. So what this committee did was they went through and had a whole questionnaire that said, we want you to go through this and answer these questions and give us proof that you have policy and procedure for this and this and what are you doing and provide them that proof. And then they were to follow that up with a 2-day visit. So they were actually going to come on site and check things out. Unfortunately, that sort of stuff I only see from the big groups, like I said, the healthcare plans and maybe the hospitals. If you're just a little, 2 or 3 doctor office and you have some business associates, you got the company that does your IT services and whatnot, you're not going to have the wherewithal to go and do that. You're going to have to hope that they can provide you with, we've had a security risk assessment. Here's a copy of what was done by this organization who's a legitimate group or what have you. Oh, you want to see your policy and procedures? No problem. Here they are. We've got training. Here's the proof of that. That's kind of what they're looking for.
Can you go into some of the other activities under the information system activity review and evaluation?
Well, that's something that you have to look, in terms of getting more deeper in the regulation in terms of what I have time for. I can show people afterwards what that is. But you can actually get that from, I'll give you some resources where you can go and get that sort of information. Also, some people taking pictures. I have handouts here from Temple. One is this handout, and this actually has kind of again, more of a high-level breakdown of what is in the HIPAA regulation. It gets about this level, it doesn't get any further, unfortunately, because it gets really kind of deep. So you're welcome to take these when you leave.
Talking about medical transcriptionists and all that, is there any HIPAA rules that dictate whether those can be outside U.S. borders?
That gets tricky too. HIPAA is a U.S. regulation, so when you start talking about healthcare regulation in other countries, gets kind of messy. And I would usually say I'm not a legal person. That's almost legal advice. So I would say go talk to a lawyer versus me. I'm more of an IT person than a legal person. So I don't want to get into making recommendations about this is legal ramification, because it does get very tricky. And I'll touch on that shortly. Is different countries have different regulations when it comes to privacy and security and so forth. When you start dealing with hey, we're going to send things overseas, and we're dealing with we're a multinational organization with stuff in other countries, that gets really kind of messy. The next one, of course, is physical safeguards. Again, as you see, this is kind of the basic things you're expecting. Do you have access control in your facility? Here's the thing: you document maintenance records of repair. I.e., you go and you make fixes and whatnot. Are you keeping a record of what was done? Data backup, media control, things like that. It's all part and parcel of the physical safety safeguards. And then technical, again, the same thing. Everyone has a unique ID. They have a password, and they're not supposed to share it. Access controls, automatic log off. That's one thing important. If you're in a high traffic area, they want to make sure that the screen, your session gets logged off, so no one can come in afterwards. Encryption is also important, both encryption and what we call data at rest, data in motion, i.e., transmission. Things about, hey, are you doing email, encryption? Are you doing full disencryption of laptops and so forth?
What, you mean user 1 and user 2 and user 3 that everybody knows and uses is not good enough?
Yeah. Because it also gave you, in fact, what I talked about earlier about, integrity. I mean, if someone's making changes in the medical records, you know who it was that was making those changes. If using a generic ID, that's not going to work. If someone is sharing a password, you can't track that back to an individual, and that can be very problematic. There's also a section on policy and procedure, basically making sure that you're treating policy and procedure like they're business records. You keep them for 6 years, which I find a little funny. Only because some of our clients, we just basically, we helped them create them a couple of years ago. So, and HIPAA training, of course, is very, very important. I went through the HIPAA regulations, kind of pulled this out. These are kind of the expected security policies. Again, everything here is pretty straightforward for an IT professional in terms of what we can expect from security policies. My thing that I see that is, if it's a small organization, I can expect them to have one big security policy document, and maybe everything is a chapter. What I hate is the ones that go the opposite way, and they overboard on security policy where they give me like 50 or 60 policies, where there's like, little onesie twosie policies that, you can take at least 3 or 4 and put them into one. I don't need a policy for how we create an account and another one for how to just, get rid of account. It's like, please, just give me one user management policy. You're killing me.
Those aren't policies, those are procedures.
Well, no, they're policies in these people case. They don't get into the nitty gritty, but it's like a 1-page policy of the high level stuff. But it drives me at the wall because I have to go through all of these, and it kills me. Breach notification is also important to make sure that, hey, there's associates who will tell you about it and so forth. So this is an example when I talk about a HIPAA control. I pulled out password because they're pretty straightforward, it's addressable. And these things they ask for. Get a procedure for creating, changing, and safeguarding passwords. Are sanctions in place if workforce members share passwords? What do they do? How do they know what to do if they forget it? And are you including as part of your training program? I.e., when you go through your HIPAA training and tell them about passwords, hey, you need to safeguard it, here's the best way to secure it, and don't share it, and so forth. So this is kind of what you see in the HIPAA regulations, in terms of what we go through and ask and check on, the clients. So I'd like to wrap things up with kind of like resources where to go next in terms of information. So training, just so I understand, there is no official approved training. There is a lot of training out there on HIPAA. Most of what I see out there, unfortunately, is more of awareness training, more for the people in the healthcare industry versus people like ourselves, as security professionals, in terms of like, okay, what do we do as security professionals to make things, comply with HIPAA? As I noted, there is no such thing as being HIPAA certified. Okay, HHS has not set that down. That's different in other areas. If you want, if an organization wants, they can be SOC 2 or SOC 1 certified. They can be certified for ISO 27001. You can be PCI certified. You cannot be HIPAA certified. It is meaningless. You can say you're HIPAA compliant, and that's what a lot of big people who sell those services as a business associate will do. We're HIPAA compliant, we're compliant with the regulations, we have a security risk assessment done, and we will give you a copy of that. We will sign a business agreement, we have training for our people, we have policies in place, and we can show that to you. But some organizations say, oh, we're HIPAA certified, and that's just not the case. They're probably HIPAA compliant, and they just don't understand it. As individuals, there are certifications out there available to you as well. Again, none of these are blessed by HHS. But these are the ones that are out there. CompTIA has their healthcare IT technician. This, to me, is more aimed at, like, say, your sysadmin type person who is managing healthcare systems, in terms of what I've looked at it. ISC Squared has theirs. I actually have that certification. It's a pretty good one. It actually gets into, like, getting you to have a basic understanding of other countries' regulations. There's also HIMA and HIMSS. If you're not aware of those two organizations, HIMA is American Health Information Management Association, and HIMSS is Healthcare Information Management Systems Society. These are two professional associations from a different sets of groups within healthcare. HIMA comes from the people who did medical records and billing and coding, and HIMSS is your healthcare IT folk. Okay. They have a couple of certs. HIMA has like 4. And the CHPX is kind of the closest to IC Squared, as well as I've looked at it. And HIMSS has theirs, which seem more aimed at someone who's like a healthcare IT management type person. So there's some books. The first 2 books are actually aimed at helping you get the HIPAA cert. I actually read this one to help me pass it. This other one I have not read, but I looked at it. It's very good. It's from CRC Press. It's very authoritative. It might be a bit much for most people, but if you really want to know the nitty-gritty of HIPAA, both security and privacy, that's probably a work to take a look at. There's some other resources out there. This is an 800-book document, which unfortunately is out of date. But this one is also really used, the SRA tool from HHS, and finally updated recently. This is meant for a small entity, let's say a doctor office, to almost like a self-assessment of their HIPAA compliance. So you can go and take a look at that. You can actually download the 3 safeguard areas. So so you can get kind of an idea of what they're looking for within the HIPAA regulation. As I said, my view is that if you have a good, thorough understanding of basic security practices, whether it's NIST cybersecurity framework, ISO 27001, if you come from that to approach HIPAA, you can do a pretty good job. It's a matter of like having an understanding of what HIPAA is looking for, but it's basic security things. The issue I see is more of the fact that healthcare is just kind of behind the times. They don't fully understand the ramifications. So we see a lot of really scary things out there. I could probably do a whole presentation on all this scary stuff I've seen. Up here, I mean, I said I work for a company that does a lot of this work. I have some material up here for it. You're welcome to take it. I said one thing that might be finding useful is this item. You can take one of the folders. This is actually already in the folder. You don't have to take both, but you're welcome to have it. The time that's remaining, any questions?
I got a question. So we've looked at the financial sectors going to PCI, agreements with credit cards. Do you see anything in the time coming down for that level of integrity for customers with their medical data? Meaning that if I'm going to be a customer coming and having a transaction, if you will, I would like to have a better available footprint of what happened.
Not really. I mean, as far as it has to come from HHS, and I don't see them doing that. You know, so
it puts a lot of you give that sort of doctor environment saying that they're handling you with your information.
Yeah. I mean, I'd love to see something like that. I mean, it'd be great to have something like, you know,